Hi, my name is Sohal. My groupmates are Sahil, myself, Elinor, Ingrid, and Umar. And this is our presentation on our ER set. So, organization is a key factor when it comes to maximizing productivity and patient care in the ER. This is one of the reasons we've decided to have our ER floor plan be divided into two floors, the ground floor being for emergent patients, and the floor above it being the floor for urgent to non-emergent cases. We chose this layout in order to provide service for our patients as fast as possible. To quickly attend to emergent or patients in immediate need of care, they will be treated on the ground floor, since that is where the ambulance can quickly come and we can begin treatment immediately. We plan to have urgent to non-emergent patients on the second floor simply because we chose the ground floor to attend. We chose the ground floor to attend to the emergent cases. On the second floor, there would be more resources since most patients who enter the ER are typically urgent to non-emergent patients who don't need immediate need of care compared to emergent patients who need immediate care. Then on the ground floor, there'll be less seating area, but we'll have quick access to the OR and other diagnostic machinery. Although having a better floor plan assists in faster patient care, there are other things that need to be in place to effectively accomplish that. What some hospitals have done to implement a faster way to finding patient medical histories was by using processes such as the electronic health records, EHR for short, and the Health Information Exchange, HIE networks. These networks help by being able to quickly receive and update patient medical history, and to be able to share them with many hospitals. Since a study from the Journal of Medical Systems has concluded that the implementation of the EHR and HI networks have significantly improved the quality of healthcare processes, specifically in reduced accidental readmission of patients.
I will be talking about tackling the issue of inadequate staffing. In order to tackle the issue of inadequate staffing, we researched the times in which the ER is the most busy to ensure that extra staff are working during this rush of patients to make sure that the ER does not become too chaotic or hectic. At Dignity Health, we prioritize making our patients feel comfortable and taken care of at all times, and we do not want them to have any added anxiety stemming from in the environment of a super busy and chaotic ER. The ER tends to be the most busy on the weekends at night when many people are out and about, so we will have extra staff on duty at that time. Since we have discovered that the most common diagnosis in an ER is a migraine or headache, we have hired extra staff that are competent medical school students to help patients that are suffering from a migraine or a headache. Through this process, we are not only helping out the community by providing medical students with a real-life experience, but we are also tackling the issue of not having enough staff for patients who may be in more serious, critical conditions. Instead of designating specific nurses to specialize in a certain area, we will ensure that all of the staff hired will be able to quickly switch from unit to unit to help whoever is in need, regardless of what category their ailment falls under. By having extra staff on duty, this will ensure that workers are not overworked and remain alert and fresh during their 8 to 12-hour shifts in order to give their best to our patients at all times. Moving on. So here is the first floor of our ER design, and what makes this ER unique is the way in which the space is utilized to create optimal efficiency. In order to make sure that patients are organized, we have two floors. This right here is the second floor, and a total of 155 beds that are divided to specialize in different patients based on their needs, such as burn patients, sexual assault patients, and those with emergent needs, as seen on the first floor. By dividing the patients on two levels based on the severity of their condition, we will operate more efficiently and be able to help more individuals. Furthermore, we will also offer a children's play area so that patients in the waiting room or visitors will not have any added stress of having to take care of their children during a medical emergency. In hopes of raising the spirits for our patients, as you can see in the bottom right corner, we also offer a church on the second floor where visitors can sit and pray and reflect for their ill loved ones. Lastly, it is important to address the fact that unfortunately, when a patient leaves the ER, they may suffer some trauma from their injury or condition that they are treated for that goes on inside. We want our patients to know that we care about their mental health and well-being even after they leave the ER. Upon departing the ER, a patient can meet with the clerk, as seen on the first floor, to schedule an appointment with a Dignity Health therapist in order to make sure that they are taken care of even after they leave us.
Here at Dignity Health, we have designed our ER in a way that creates a safe and comfortable space. Upon entering our facility, you are met by a public access entrance and the reception area, allowing patients to immediately check in and state their needs. This region is placed in the center of both our first and second floor, so as to ensure a smooth and quick workflow. A patient may also be admitted through ambulance drop-off, in which the patient is in the hospital's care. Following the patient check-in, you are directed to the triage, where designated staff will assess the urgency of your condition and determine your priority from there. After the triage process, a triage worker will provide you with a buzzer. This buzzer provides you with a map of the hospital, estimated wait time until you are to be seen, as well as room location. A waiting room is placed to the left of the triage unit, in which we provide sitting areas, television, bathrooms, a question center, and an entertainment area for children. Our purpose is to cater to all patients and to ensure the most effective care. In order to fulfill this responsibility, we have designated the first floor for our mid-emergent and emergent patients, while the second floor is designated for our urgent patients. We place focus on ensuring that our patients feel prioritized and important. Thus, we have designated an area with a total of 40 beds for burn patients, head trauma patients, and sexual assault patients, located on the first floor. A flight of stairs and an elevator are available for patient use. The second floor includes a pharmacy, radiology room, and lab test room located on your right as you enter. In an effort to accommodate to all patients, our facility has placed a prayer room and children's room to the left of the reception area on the second floor. During your visit, we will also provide you with food made daily in the cafeteria. Plant-based food is also an option upon request. After your visit, you will be directed to a follow-up clerk who is responsible for informing you of necessary returns to the hospital. Here, the patient will also have the opportunity to schedule appointments for future visits.
At this new Dignity Health location, we will be catering to a wide variety of people. For example, we will be catering to people from the Elk Grove area and also people from the subsections of Sacramento. Given that Elk Grove's population reaches about 170,000, we will be expecting a surplus of people coming in. For example, we will have about 20 patients a day per doctor, and given that we have all these patients coming in, we'll need to accommodate for this with adequate staffing and also adequate bedding. Given that so many people are going to be attending these emergency departments, we want to ensure that our visitors are safe at all times. We want to make sure that nobody gets lost. In order to do this, we would add pathfinders all along the hospital and also charts and visual aids to help people get to where they need to go. Also, we would add hand railings. Hand railings are used as support for elderly, handicapped, and those who are anxious or grieving. These hand railings will provide support no matter what they're used for. Also, we would need to hire security at the emergency department. To make sure that our visitors are safe, we want security to monitor all sections of the hospital. The ER room is a very stress-inducing area. Equipment distribution and sanitization. To make the flow of traffic in the emergency department go by faster and smoother, we would like to ensure that every room is equipped with the proper equipment and is also sanitized at all times. Make sure that each room is equipped with the proper equipment. We will be using all the equipment that is described earlier and placing it in every room. Also, we would like to have a computer in each room that allows doctors to receive all diagnostic imaging and also lab results with a really quick response time, and also be able to share this information with other departments in a smaller amount of time. Also, there will be a designated area and job for refilling the equipment that is used in every ER room. This will ensure that every room will get the equipment it needs and in a timely fashion.
Hi, I'm Umar Yusuf. So tools and accessories in each room. Each room will come with different tools and accessories depending on what the room is being used for. Each room will come with the bed, allowing the patient to adjust the bed to a position that they find most comfortable. Computers, allowing the doctors and nurses to access information of the patient. Chairs, which can be used by visitors. Stethoscopes, cardiac monitors, suture trays, orthopedic equipment, and everyday equipment needed for everyday care and checkups on patients. The buzzer. Our hospital will offer a buzzer which each patient can be given at the front desk. The buzzer will have 3 buttons on the bottom, showing a map, which will show a map of the hospital and the floors of the hospital and where each area of the hospital is. An estimated wait time showing how long the patient will have to wait until they'll be seen by a doctor, and a help option allowing the patient to receive help by somebody who can help them with any questions they have. The buzzer will do many things to improve the flow of traffic at the hospital. It will lessen the need of nurses to go into the waiting room and escort patients into their rooms. It will also make the process of patients going from one area to another a lot faster, and it will lessen the need of patients to ask questions and be confused as the buzzer will do a lot of the assisting they need. And it will also help increase the flow of time and how long people will take to be seen, as if people are asking less questions and doing less looking around, then the hospital's process will go much faster in general. There'll also be a notification voice at the top, which will notify the patient when it's their time to be seen. They can go to the back of the hospital, use the buzzer to enter the back and go into their room. It will also allow them to see exactly where their room is so they can follow the path and get to the area without having to be escorted by a nurse.